All right. Welcome to the Public Safety. Today is July 6th. This meeting at 7 p.m. We have Councilor Derby and Councilor Rothschild here. We are still doing this meeting due to doing remote due to COVID restrictions. So we're expecting to going back to 50 patients soon. We don't have any minutes to approve. So public speak time. Is anyone here that want to say something that is not part of the agenda and part of the agenda? Because then we're gonna, now is the time to talk. If you want to talk about the police report, if you want to talk about anything you want, this is the time, because then it's going to be only the councilors and the fire chief, because we're going to have a report from him. So Caroline,
Stephen, too.
I'm sorry. Yeah. Let me go with Caroline and then Stephen.
Oh, okay. I just this is kind of a request or orientation, now or just when you get going, like, where is the committee in the process? Do you anticipate other things happening? It was the idea of the legislators coming, but they're not here tonight. So some kind of,
Yeah, I'm going through that soon.
Yeah. And then someone,
I'm sorry, just 1 second. I'm going through the agenda first, and then I'm going to explain why the state rep and the senator are not here and where we're going. That's part of my plans, but now I'm going to let everybody talk before we start talking about it.
Okay. Great. And just a thought, I don't know, maybe Rebecca would speak to this too, because I've been following along, going to the CRC meetings and went to the last one. And there are some recommendations in the report that the CRC isn't sure that they would take on. So it's good to see Rebecca's here, the communication between the committees, because I was wondering how that would happen if they're not going to take it on, different discrepancies. So that's it. Thank you.
Thank you, Caroline. Stephen? We cannot hear you. You're muted.
Oh, we've done that a million times. My bad.
Thank you.
I guess I came in muted. But thank you. I just wanted to take a few moments in public speak, because I don't believe this item is officially before the committee, although in a very brief communication with Councilor Derby, perhaps it might go on it. But this is relative to the roundabout on Park Street. I live nearby, and a couple of months ago, I learned from some of the folks standing around doing the construction work that the southbound lane of Park Street was essentially going to be subsumed by an extension of the lawn properties on the south side of the, on the west side of the street. I mean, obviously I followed the roundabout, but I wasn't aware of that. And the folks there were kind of laughing about it a little bit, but the question really came about was the facilitation of public safety vehicles through that intersection. My understanding from reviewing the traffic report that was done, I don't know, 2.5 years ago, was that there was anticipation that there would be backups twice a day, which of course makes sense, pick up and drop off for the new K-8 complex. I do not know whether that study done at that time incorporated the particulars of the roundabout or not, but the question in my mind was whether or not at times in which, those 2 times a day, whether there would be an ability to get public safety vehicles through that and maintain satisfactory response time. Obviously, anyone living south of that intersection, and certainly anyone who is in attendance at the school complex, the response time, of course, is very critical. So I did contact the planning department. And basically, actually, I was just trying to get a contact for the traffic engineer. I figured that the traffic engineer should probably have, the answers to the questions, readily. It seems to be somewhat of a mystery about whether or not there is or is not a traffic engineer on duty in this project before it opens. So I've never been put in contact with that. And that person's never been identified to me. Instead, I had been directed to the fire chief, who I'm glad is part of tonight's meeting. We've had a couple of discussions, but I haven't heard back from him since he was going to follow up precisely about that. I know the fire chief would say that he has brought his largest apparatus, which is his hook and ladder, and has been able to negotiate the roundabout, which of course should go without saying. I would assume that we wouldn't design a roundabout that wouldn't accommodate each and every vehicle that would need to go on that thoroughfare. However, that wasn't the question. The question was, what happens in times when it is expected to have a backup there? And I thought that this question should be answered before any surface area at or around that intersection is taken away. And so that's why over the past 2 months, I've been trying to follow up in any direction I can to try to understand it a little better. So, Councilor Derby indicated that maybe it might be something that public safety would take up. So I made a point to join tonight's meeting at Public Speak to at least, I don't know, maybe get that ball rolling before everything is kind of finalized. And more importantly, before the complex becomes operational. So that's the background.
Thank you. I take notes about all your concerns, and I will do my homework finding out about all the information. And if it is necessary, I will add it to the agenda. We can discuss it as a part of the public safety. But I will take notes. And if it is possible, because I'm going to ask you for something, but I don't want to do it publicly. I don't want your number be public. So can you send me the email to my with your information? That way I can contact you and talk about this. So that way we can figure it out and get the information.
Sure. Omar, I can catch up with you too, Omar.
Thank you.
I can catch up with you. I have some
Thank you.
on this too. Yeah.
Okay, great. Thanks. Shelby?
Hi, can you hear me?
Yeah.
All right. Yeah, tonight I would just like to talk about safety in the form of firearms that are in our community, particularly the ones carried by members of our government and the police department. I recently made a public records request to the Easthampton Police Department, looking for documents listing the firearms that the department owns and the qualifications of the officers who carry them. The response I received from a hired law firm is that it would take an exorbitant amount of time to find these documents, and that it would cost a $25 fee for an hour of work that it would take. It would also take 15 business days to receive these records. Records that the Easthampton Police Department, in their own use of force policy, describes maintaining and using for accountability. The public having to pay and wait over 2 weeks to gain this accountability of firearms our government buys and uses in our community is unacceptable, especially when a similar request made in Boston recently shows that their police department had, quote, lost one of their firearms in the community without it being reported or noticed. If the Easthampton Police Department has nothing like this to hide, they should be happy to share with the public their record of accountability and qualification. This is an unacceptable way for any department in our public safety complex to act. These are weapons that can end a life with the pull of a trigger, and the public has a right to know what kind and how many the police department has, as well as the qualifications of the officers that carry them. I don't see any other hands raised. Should we go down and raise again, though, for my spouse to speak?
Yeah, I'll let you go talk.
Okay. Mine's kind of to the same note of public safety and accountability. accountability is a fundamental part of public safety. Accurate record keeping is the basis of accountability in all municipal departments. Since January 1st, 2017, the Public Records Law has required every agency and municipality to designate a records access officer to assist requesters in obtaining public records. And from my experience with requesting records in this municipality that are actually mandated to be maintained by Massachusetts General Laws, Part 1, Title 15, Chapter 94C, Section 47, regarding financial assets, I was responded to also by an attorney stating that 15 business days would be required to produce this mandated record plus a fee for the time used. As you know, my spouse received an identical response to a request for a document maintained by a municipal department that's stated in their own operating and accountability policy documents regarding high-cost inventory items, including firearms. So with these responses in mind, I find it problematic to hear Councilor Rothschild and others suggest that we should increase budget spending to perform record keeping. That's already part of the basic requirement of the existence of these municipal departments and a fundamental basis of our democratic governing bodies, especially when these records are essential to accountability and ultimately to safety of community members. Even private individual members of the community are required to keep and maintain these types of documents relative to themselves, and it's not an unreasonable expectation of a governing body. You know, we even have designated individuals responsible for collecting these records from their departments for the last 4 years, according to the state law. And these responses to these requests for like mandated records should be kind of unacceptable, I feel like, to everybody, because they're, you know, records that they're required to be maintaining all the time. So they shouldn't be like, these requests specifically are regarding records that should be maintained all the time. So they shouldn't be something that has to be like dug up and gotten together. You know what I'm saying? And that's all I had to say. Thanks.
Thank you. I make some notes and I will be contacting the police chief to find out all the information that you guys are requesting. Anyone else? Rebecca, do you want to give us an update about what happened at the meeting?
Sure. Well, currently, the Community Relations Committee has been participating in trainings with a representative of the Department of Justice named Derek Dean. Let me just say, for anybody who hasn't followed the whole history, way back when there was a spirit meeting in the city, that's under guidance from the Department of Justice, which has a community relations service. And out of that meeting, some concerns were identified, and the mayor created the Community Relations Committee, which is brand new to this town, and I'd say new enough that when I had my interview with the mayor, it seemed to be understood that it was going to take a while to let's say, be in smooth operations. And I would say that's certainly been true. And I'm very glad to be undergoing these trainings with Mr. Dean, because we have a city ordinance, and the question is whether there's enough resources or powers even to implement it. So we're learning from Mr. Dean that a community relations committee can have 3 different functions: advisory, facilitation, or quasi-judicial. I could get into that if people want. I think what the mayor's pledge work group looked at was, and among the recommendations, is having a staff member that would assist the Community Relations Committee, especially if some of the higher level functions should be part of their role. So if, for example, if the Community Relations Committee took on a quasi-judicial role, in other words, if people could submit complaints to us and then that we would have the power to settle those, well, we need some power. We would need staffing that requires investigations that right now the volunteer committee isn't staffed to do. So I think that what we're looking at is we're looking at recommendations from the mayor. We're looking at some training and a poll that of the committee members that Derek Dean is conducting. Also, right now, we only have 8 committee members while the whole mandate was to have 11 members. And it sounds like the mayor would like to review the outcome of these sessions as she considers applications of new people to come on to the committee. We need to be, I'm hoping that the committee then will at least make some initial agreement as to which role that we are focusing on so that we can do a good job at it. But I will say this has been new to all of us, and as we can see, this is still a work in progress, and I'm pleased to be here to with the Public Safety Committee going over these recommendations. Thank you, Councillor.
Thank you, Rebecca. All right.
Just one second. Stephen, what precinct do you live in?
I think it's a 4.
4.
Yeah. I want to start saying that I do invite the state rep, Dan Carey, and the John Villas. Senator John Villas is on session today. He was planning to showing up to the meeting, especially I saw him last week and we briefly talked about this meeting. He was really excited that he will be part of this meeting, but sadly he's in Boston and he cannot join us today. Same with Dan, with State Rep Dan Carey, but he sent us some information that I sent it to the other 2 councilors and eventually share with the public. And I will ask Giles to include that documents on at the minute, so that way the public can see them too. Besides that, I'm going to end talking about that later, but some updates about the department, and I want to start with that, and then we're going to start talking about the state and the report that came from Nicole. Chief, are you around?
Good evening and thank you. Can you hear me okay, Counselor?
Yes.
Okay, perfect. And good evening, everyone, and thank you for allowing me to take some time just to provide some updates as to the ongoings of the fire department. This actually came about a few months ago when Councilor Gomez and I had met, talking about different options and opportunities as to how to engage the City Council Public Safety Committee in terms of keeping you folks updated on as to the different initiatives and projects that are completed within the fire department. And essentially what we basically talked about was providing this forum on a quarterly basis to do those updates. So that's kind of what brought us here to where we are tonight. I did provide Councilor Gomez a quick email as to a brief agenda on the fire side, along with some statistics I'd just like to go over briefly. Councilor Gomez, did they get a chance to see those? Do they have those available right now or no?
Do you have it with you? Because
I don't.
I make you a co-host. You can share it with us if.
I don't have them. I don't have them electronically right now. I didn't know if you had a chance to send those out electronically or not. There they are.
No, is that one? Let me see.
It was that one you just had up.
Let me see. Okay. Can you see it?
Yep, that's the one right there. Perfect. Thank you, Councilor Gomez.
Okay. Yep.
So I wanted to start off just by giving everyone a brief update as to the hiring process that we've been going through since March. As most of you know, the fire department is a civil service organization. And with that, that's how we go through the process of hiring new candidates. The new list came out this year. And when that new list was certified by the state, we basically sent out 234 cards across the entire state to paramedics on our list in Massachusetts. And out of those 234 cards that went out, we had 4 people sign the list of interest for Easthampton. And then 2 people actually came in physically and completed the application process. We moved those 2 completed applications through the remainder of the hiring process, which consisted of a medical, a physical, and an interview process. We did background checks. The police department did background checks for us. And those 2 new firefighters that went through that process started on June 9th. Both of them are paramedics. We're very excited to have them as part of our organization. They went through a 3-week orientation, and currently they're assigned to a shift, finishing up that orientation process. The third opening that we had, based on an individual that left back in the late fall time, we actually had a candidate from the Holyoke Fire Department who was interested, and the civil service process allows for what they call a lateral transfer. And it actually benefited the city of Easthampton and Easthampton Fire Department in a number of ways, one of which is that individual has already been through the State Fire Academy, which is a 10-week recruit program, so he won't need to go through that again. That individual will actually start tomorrow for his in-house orientation, getting familiar with our equipment, our resources and policies, and he'll be assigned to a shift next week. So what that does with those 3 new people coming on over the last few weeks, that brings us up to full staffing. And that's particularly of importance with the SAFER grant that we have, that staffing for adequate fire and emergency response. With that, we committed to maintaining 31 full-time firefighters in the department. So that was pretty significant to bring us up to full staff, and particularly going into the summertime. So where does that leave us right now? With those 2 new firefighters, they'll be going to the fire academy. You'll see right there one of the bullets on, they'll start the academy on October 12th. And there certainly was opportunity to send those 2 new firefighters who we just hired earlier, but we're purposely not sending them to the 10-week recruit program, which is held in Springfield during the summer months, because obviously that's during peak vacation period. So in terms of trying to better manage and control some of the overtime within the fire department, we did our own in-house orientation where we've assigned them to a shift. So now we're able to use those individuals to help cover some of those vacancies while people are on vacation during the summer. So their applications have already been accepted for October, and that's when they'll begin that 10-week program. And then the one firefighter from Holyoke, you'll see there in that bullet, who's already been through the fire academy. He's a basic EMT. We have him signed up for paramedic school at Greenfield Community College, and he'll start on September 8th. So that gives you a brief overview with the 3 new firefighters that we've just hired. The last 3 firefighters that were hired prior to my tenure, beginning last July, those 3 firefighters were hired last March of 2020. They have completed their fire academy recruit school. They're just finishing up their paramedic program now at Greenfield Community College, and they're slated to be done around the end of December. So that will be another achievement and milestone for the department to get them fully trained and out there on the ambulances as well. And then finally, just for personnel updates, one of the last initiatives we're working on right now is implementing a new training captain position. The Easthampton Fire Department has never had a full-time dedicated training officer, and that's been problematic over the years. Particularly when you try to assign the shift captains that role, and based on the call volume and the necessity to get them out on apparatus and particularly ambulances, you just lose the continuity of continuing that training and the oversight while trying to complete that on duty. So this position will actually have a dual purpose and a role. Obviously, number one, it'll help develop, implement, and deliver the training to provide a consistent training format and framework throughout the year for all members for both fire and EMS. And the other purpose of this position, the way we structured it and designed it, is it will act as a swing shift. So anytime a shift captain is out on a weekday and that person's available, instead of hiring back a captain on overtime, this training captain can cover that shift vacancy throughout those weekdays. So it really serves a dual purpose, multifaceted, that certainly will benefit the department going forward in a number of ways. Looking at our budget, we closed out the budget this year. Brenda Ruthier worked very hard with the mayor and her financial team in Hadel in City Hall to close that out. We were able to complete a few initiatives there. We were able to purchase one set of protective equipment for one of the new hires. And one of the things that we've worked with the mayor and her financial team going into this fiscal year is the understanding and need to immediately purchase 2 additional sets. Obviously, with 3 firefighters, the one set obviously isn't enough. We can't share it. It's actually custom designed and measured for each individual firefighter. So coincidentally, tomorrow we have the sales rep coming in to measure those 2 additional people so we can purchase those 2 additional sets for this fiscal year. With overtime, obviously I talked about a couple of ways we're trying to internally manage and control the overtime. The first one by holding off on sending those new employees to the academy, which I mentioned. I talked about the implementation of the new training captain and how that's going to act as a swing position with a swing shift to minimize hiring back on captains. And then the last one there is just maintaining full staffing of the department. Now that we're up to the 31 positions, obviously in any emergency service organization, when you drop down in your full-time employees, that needs to be made up somewhere, and it needs to be made up through overtime. Now that we're fully staffed, that certainly is going to help us, particularly going into the summer months. As always, you can see that last bullet there. There's always some variables. The ones that I always just try to educate and remind people about: injuries, long-term absences such as family medical leave, and then obviously the significant events. Obviously a fire, a major natural event, things of that nature. Those are really the 3 factors when you look at it that cumulatively can drive the overtime up without limited control within the organization. So those things that we just need to try to manage as we move forward. When you look at some of the grants, we've always, over the last year or so, really looked at alternative funding sources. We have a couple of them that are out there pending right now. The 2 most significant ones is the AFG, which is the Assistance to Firefighters Grant. That's a federal Homeland Security grant that comes available every year. It enables departments across the country to apply for both vehicles and equipment and resources. So we applied for a new ambulance in the amount of $295,000, and then the replacement of some hose that's expired in the amount of about $30,000. I'm hoping to hear within the next 4 weeks or so the outcome of those grants, and certainly we'll keep you posted in that. One that Captain Benson's working on right now is through the Leary Foundation. He's been assigned this grant program looking at an application for some new training equipment, particularly forceful entry equipment. And then the last one that was submitted through the state of Massachusetts was for 3 ultrasound machines. The state protocols changed this past April, and for the first time ever, it enables any ambulance service to utilize ultrasound machines as part of their therapies and decision-making process pre-hospital. So we applied for 3 of those and are hoping to hear within the next month for those as well. When you look at this past year and some of the initiatives that we're able to complete, one that we're particularly proud of is the meal deliveries. The mayor and her team met with us back the end of March. And on the week of April 5th, we started working with the mayor and her staff and delivering meals to a number of families across the city due to COVID. And over the course of 11 weeks, the fire department was able to deliver over 2,400 meals to many of these residents across the city during that time. That provided other opportunities. Particularly, we did some fire safety and education outreach. And then the one that also fit nicely in there was education on the vaccines. We were able to put flyers in there and educate people about the regional vaccine clinic at Northampton Senior Center, and then also the vaccine clinic that was organized by the Board of Health and Bree and her team at the Easthampton High School. So it not only helped provide the meals, but also a great public educational outreach component as well. Live fire training, we were able to finish that up last week. That worked exceptionally well. We were down to DPW. We had a mobile live fire training prop brought to us by the State Fire Academy. And that certainly is one of the areas we need to continue to focus on. Certainly the way I always try to educate people on this is one of those low frequency but high risk tactics that you need to keep your skills up on. And by having the ability to bring that right in our backyard and conduct a lot of the training on duty certainly was a huge asset to many of our personnel. So that was great to complete that. We were able to complete all the maintenance and service on all the equipment. The extinguishers had their annual service. We did hose testing with an outside vendor for the first time. All the ground ladders, the vehicles, the ladder truck, all got their annual service and were updated. And then for the first time in a while, we were able to, with some alternative funding through grant opportunities, we were able to replace 13 individuals on the department who had old expired gear, which essentially means some components of their gear were more than 10 years old, which is outside the national standard. We were able to replace all of that gear and surplus it. And we currently now have, finally, everyone in the department 100% compliance with all their personal protective equipment or PPE. Councilor Gomez, if you can flip that page, just so we can finish up on some of the initiatives we completed this past year.
I'm trying. I don't know why. There you go.
If you, yep, perfect. There it is. You can see in the upper left-hand corner there, we talked about some of the grants that we've had already gone after, and some of them that we've already received. We'll continue to wait on some of the other ones we talked about. We really have tried to increase our public outreach on social media to help educate the public about what's going on, what do we actually do. We'll continue to do that. We're excited about the city website that's being revised with the mayor and Lindsay and their teams with that. We did the train the trainers for that. So that will be good to get the new website up. We did the city school for the counselors, which hopefully was a great forum to help, again, educate the city leaders about what's going on. The vaccine clinic. We participated in 2 vaccine clinics. The first one, and probably the most labor intensive was the regional one in Northampton. We had 13 of our paramedics partner with them over there for well over 2 months. And that was a huge success to get the ball rolling. And then Bree and her team to the Board of Health did an exceptional job bringing that locally to the high school. And then the other one, I don't think people have heard about or know as much about, is they actually also did home visits. We partnered with the team from Amherst and the Amherst Board of Health, the Amherst Fire Department, Easthampton Board of Health, and Easthampton Fire. And we probably did close to 50 home visits for homebound individuals who had no access or means of getting to a clinic. So that was one area that we were extremely proud of as well. COVID-19, that certainly took a toll on everyone. I think that goes without saying. Certainly both physically, mentally, it just took a toll and drained on a lot of personnel. When you think about transporting many of these COVID positive patients in the back of an enclosed ambulance in an 8 by 6 foot box, it heightened some awareness. And we were able to work with the state and the emergency management agency to get the proper equipment to protect our personnel. And hopefully we're seeing the tail end of that now. Technology, we were able to upgrade a number of technology in terms of our laptops for documents and report writing throughout the department. The IT department has been exceptional in terms of bringing in different software programs for both fire and EMS reporting. We talked about the importance of education and training. We did a number of CPR classes, one of which we did at City Hall. We were able to train many of the City Hall employees who wanted to in CPR and the use of a defibrillator. And then we were able to procure funds to actually put a defibrillator in City Hall for public access as well. Professional development has been going great for the officers. That certainly is one of my goals in terms of succession planning, is to continue the professional development of all the officers, to the point where we just received notification today that one of our captains achieved accreditation through the state for their fire chief credentialing, which we'll get that up later on, but that certainly is a huge testament to their ongoing training. The Easthampton contract, I'll talk about that when I show you some of the charts and graphs later on, but we completed our first year. Again, that started last July, where the city of Easthampton provides 100% EMS transport for all calls in Easthampton. That has gone exceptionally well. We're starting year 2 now, and we'll continue to monitor that and provide feedback to you folks on that. The car safety checkpoint has been going very well. We've been trying to implement that at least once a month. Obviously, with COVID, it created some logistical challenges in terms of facilitating that. But now, again, that we're coming out of that, we're hoping to do more with the infant car seats and helping the public, making sure those are done properly. And then finally, in terms of what we completed this year, was just increasing the training both on duty and off duty. Again, when we looked at past records, particularly for the Insurance Service Organization, which grades the insurance level across the city for both commercial and residential, the city of Easthampton in 2018 received a 5 out of 10. And one of the biggest deficiencies they received was the lack of training. Out of 10 points, they received 2. So we're really looking at trying to increase and heighten that to increase the overall ISO rating in the city. Going forward, what are we looking at? This year, we have a number of different initiatives. One of them is a program called I Am Responding. The mayor asked me about a month ago, hey, I've seen a few hydrants across the city that are have bags over them and are out of service. How are you notified about that? And right now, there's really not a good system to provide that information. So we're looking, this is one of them that helps map hydrants, the hydrant mains, the hydrant locations, whether they're in service or out of service. AVL, automatic vehicle locators, has that capability. So when a dispatcher is looking to tone out an ambulance, if ambulances are already out in the city, they can tone the closest one. So those are some systems we're looking at. We currently have a contractor in place to come in next week to service the Vision 21 system and fire dispatch. That Vision 21 system, you can think of it as basically a big meter, and that meter oversees all of the different fire alarm systems in the city. It comes right into this Vision 21 system, and that hasn't been serviced in a while now. So that's coming in. We're going to get that updated, cleaned up, and ready to go going into this year. We're going to work with HR on updating some of our job descriptions. I talked about the website build out with Lindsay and her team on that. We're excited about that. Backup cameras. One of the things that is always problematic across the country is motor vehicle accidents with emergency vehicles, to the point where it's usually the second leading cause of injuries across the country. And backing up these large vehicles certainly has its share of problems. So we're looking at this year putting in a backup camera in engine 2, which is the newest engine to 2018. Typically, newer vehicles have these already pre-installed. For whatever reason, this one did not. So we're going to look at getting quotes for that and having that retrofitted with a backup camera. Replacement of ambulances, I kind of alluded to this already in terms of the grant that's pending out there right now. Again, just as a point of information, we have 3 ambulances, A1, A2, and A3. A2 and A3 each have over 100,000 miles on them right now. And A1 has 65,000 miles on it already. Typically, the industry standard is any ambulance that has over 100,000 miles on it, you start to look to surplus that and trade it in and get that replaced. So that's what we're hoping one of these grants will come through to help replace one of those. We're looking at doing an open house in the fall time. Again, once things open up and COVID kind of starts to go downhill a little bit more. The safe education in the schools for both the elementary and the high school folks. We're looking to get in there and work with the school administration and doing some educational programs in there. Today, we were just talking about fire extinguisher classes today. One of them that we'll be doing shortly is with Williston. And then we're looking at maybe partnering with the Easthampton Business Association and maybe offering up some fire extinguisher training to that group. Radio communications are always a challenge. Some of the infrastructure is old and needs to be updated. That's one of our goals this year. And then finally, just working with the mayor and her financial team on the overall fire department capital improvements. We've been working this week. We have to, all departments need to get that to her by this Thursday. So we're working on just finalizing that. I know that was a lot. I don't know if you want to pause there, if you want to just go in and finish up some of the stats that we've provided for you for last fiscal year. Do you want to just keep going, Councilor Gomez?
Yes.
Okay. If you go back one, Councilor Gomez.
Just one second. There you go.
Yep, there you go. So that first chart there basically just is a picture of some of the overviews of the calls and the breakdowns of calls throughout the year. So this is last fiscal year. We did 2,917 calls. And you can see in that chart above excuse me, just over 80% of those calls were emergency medical services related. We did 28 fires, and then you can see the other breakdowns there as you look at the overview of that 2,900 calls. That is an increase from last fiscal year. And I was actually surprised that the overall call volume wasn't less because particularly when you look at COVID, during that time, a lot of people didn't want to go out or weren't out that much. And that typically was a theme throughout the entire year. But even with COVID, our numbers still creeped up a little bit. If you can go to the next page, Councilor Gomez. The chart on the left, again, looking at last fiscal year, this looks at incidents by the hour. So in terms of looking at some of our driving factors and numbers, you can quickly see that if you look at 8 a.m. through about 8 p.m. or 9 p.m., you can see where that kind of spikes up a little bit. And that makes sense. People are out and about in the communities. They're out in their business. They're out driving in the city, motor vehicle accidents, medical calls, things of that nature. So that one makes sense, and it gives you just a visual depiction of some of the peaks and trends for call volume. And then the one on the right gives you the days a week. And that one there was pretty interesting. There wasn't a lot of variance, where typically you do see some variance, and that variance usually actually is during the weekdays. Some people would think it'd be on weekends, but during the weekdays, you usually see a small spike. This one has it a little bit. Usually you see it a little bit more pronounced, but this one is pretty close to insignificant in terms of which days created more calls. Councilor Gomez, if you could just pop forward. The next one on the left, again, you can see up top the overall incident count. We talked about the 2,917 calls, of which when you look at EMS, 2343 were EMS related and 574 were fire related. You can see one of the significant losses of $200,000. That was the fire on Church Street. That was essentially almost a total loss from that fire. That's where that number came from. The certificate of occupancy checks, that middle column, those middle rows, you can see in red 56. That gives you an overview of carbon monoxide incidents, carbon monoxide and certificate of occupancy checks across the city. Usually you don't see that high of a number for CO, carbon monoxide incidents. So that was interesting to see that high of a number for Easthampton. Under mutual aid given and received. So over the course of last year, we went to mutual aid 310 times. Some of that number is Westhampton. When we do the documentation, that needs to be counted as mutual aid, but that only accounts for about 89 of those calls out of the 310. And then we received mutual aid, other services coming in to help us, 48 times. The next one, overlapping calls. This is one I always kind of monitor. It's interesting. Overlapping calls, 27.12. So essentially what that means is an ambulance goes out, and while they're still tied up on a call somewhere, another call comes in, which has that overlapping call. So close to 30% of our calls last year have overlapping calls for either fire or EMS or both. And then the last two sections there, you can see response times. Dispatch to arrival is broken down for both EMS and fire, 6 minutes and 57 seconds and 6 minutes and 46 seconds. So basically from the time we're dispatched to the time we arrive, those are your time intervals. And then the turnout time, the last few rows there, the average turnout time for EMS is 139, and for fire it's 203. And that is from dispatch to en route. So that gives you a quick snapshot on those. When you look at the one on the next chart on the right, this one here, if you minimize your Zoom window so you can see the bottom right-hand chart, that's the one that you really want to look at. So back in September, we started changing the way we collect data. And in that bottom right-hand corner, you can see that square. And that square basically shows you out of all the EMS calls, and this is just EMS calls from September 1st through June 30th. September 1st is when we started collecting this information. We did 241 calls in Easthampton. We did 89 calls in Westhampton. We did 44 calls in Southampton, where we were the primary ambulance respondent out there. We did 31 calls to Southampton as an intercept, which means that they had an ambulance on scene, but they needed a higher level of service to provide therapies that they were unable to provide due to their staffing. We went to Holyoke 27 times. We went to Northampton 25 times. And then we had some other miscellaneous intercepts 9 times and some other public assists 7 and 3 times. And then we did an intercept to Holyoke once. And again, when you see intercept, that means that they had an ambulance but needed a paramedic level response that they didn't have. And when you see just emergency, that was when they had no ambulance available. So essentially, you look at, for example, Southampton, it's broken out 44 and 31, but obviously we went there a total of 75 times since September of 2020. Perfect. Thank you, Councilor Gomez. The next one shows you, again, a picture of where we actually transport to. And I'll tell you to look at that bottom right-hand square again in the left-hand document. And what that will show you out of all of our EMS calls, obviously most of them are brought to Cooley Dickinson Hospital. In fact, we brought 1,255 patients to Cooley Dick. The null, you'll see null 593. What that is that's where we actually respond to a medical call and there's either no patient or no transport because it's a refusal. So people may call for a lift assist. They need help getting up. They maybe have a diabetic emergency where they want us to check their sugar. We make sure they're okay. They're with someone who's capable of caring for them, providing that continuity of care, and they don't want to be transported or transport themselves. That's what that null is. We went to Bay State 261 times. We went to Holyoke Medical Center 143 times. Mercy Medical Center 14 times. Noble 7. A few other hospitals, sporadically 3. And then Franklin Medical Center, we went there once. And just as a side note, that was my call that I went on. Myself and Pat Eline took that call to Franklin Medical Center. So that gives you a good depiction of where we actually get pulled and have to transport these patients based on their needs or sometimes they're actual requests because they've had other therapies or patient records at those respective hospitals. The next document, as we wind down here, revenue. This one's always interesting in terms of tracking the revenue. And the two columns I'd ask you to look at, the three columns I'd ask you to look at are the three columns on the left-hand side: the month, the commitment, and the credits. The month, obviously, self-explanatory. The commitment, that's actually what's billed out each month. And the credit is actually what is collected for that respective month. So you can see as you kind of look down through there, what was billed out, what was collected. And as you go to the bottom of those three columns for FY21, you'll see we billed out just over 2.1 million, and we collected, in terms of our patient transports, $806,000. On top of that $806,000, we also billed the town of Westhampton for the contract $25,000, and then Medicare, which I'll talk to in a minute. Medicare has a supplemental program in terms of revenue collection. We collected $80,000 extra back in October from Medicare. So when you put all those together, we collected just over $911,000 this past fiscal year. One of the challenges is, I tell people the three driving factors as to your credits is basically, number one, call volume. Number two, the severity of the call. Is it ALS? Is it advanced life support, or is it basic life support? And then the third driving factor is the actual insurance provider for the individuals that are transported. The city of Easthampton has what they call a payer mix. 75% of the people we transport are on Medicare, Medicaid. So regardless of what you bill them in terms of the normal industry rates, they'll only reimburse you that fixed amount. So that's why you see such a large discrepancy between what's actually billed and then what's actually collected. Councilor Gomez, can you go to the next page, please, as we wind down this? These are the last two pages here. Looking at the revenue, we put together just kind of a trend line for everyone going back to 2010 in terms of what was collected by the city of Easthampton. So 2010, fiscal year 2010 to 2021, you can see that trend line going up with that spike this past fiscal year for 2021. That spike partly was driven by the Westhampton contract, partly was driven from some internal changes we made in terms of efficiencies, and then also just kind of tightening up our report writing and documentation as well. So that was great to see that trend up significantly this fiscal year. I put right underneath it the call volume for you. Again, that's one of the driving factors in terms of what you collect. Obviously, the more people you transport, the more patients you have, naturally it's going to go up. So again, you can see that trend line is pretty consistent with that trend line going up. And then the last side of the page there on the right-hand side, in terms of just documentation, one of the things we started looking at is overall fire protection. And we're trying to balance in Easthampton Fire, providing both fire services and emergency medical services. And we really just need to start better documenting and tracking how these resources are utilized. So you can see the top half of this document above the yellow line is going to be the month of June. I just put this up here for an example. So every month I look at, did the call require a callback? So for the month of June, 33 of the calls required a callback, 244 did not. Did the callback get filled? 7 of those 33 callbacks did get filled with people off duty coming back to backfill and cover the station for additional calls. 26 of those callbacks did not get filled. How many people returned on the callback? Was it 0, 1, 2, or more than 2? So 22 times, 0 people came back. 7 times, 1 person came back. 3 times, 2 people, and then 1 time, 2 or more. And then the time without fire protection. So this is actually defined when we have time without fire protection means we have 2 or less people available. And even using that as a definition, we picked 2, basically 1 person to drive the engine and 1 person to start stretching a hose line, which obviously is not near enough to complete all the tactics. But for this exercise, we said 2 or less, how many times are we without fire protection? So in the month of June, it was over 17 hours. And then the longest time period was there was one time, there was 150 minutes where people were out on EMS calls and there was no fire protection. And then the very bottom there, under that yellow line, what I did was I took the averages from October to June. October is when we started collecting this information. And when you look at October to June and the averages in terms of time without fire protection, it averages over 13 hours a month, where those overlapping calls, which I talked about before, there's about 13 hours sporadically through the month where there's no fire protection. And then that 150 minutes was the longest time. So I know that was a lot, but I just wanted to, more than anything, bring this committee up to speed with the past year, what we've done, what we're looking to complete in terms of our initiatives going forward, and just some of the data and documentation to help better understand the services that are being provided by the men and women in the Easthampton Fire Department. And with that being said, I'll mute my mic and answer any questions anyone may have.
Thank you, Chief. I cannot see Salem. You guys have any questions?
I do. Just, hi, Chief. Thank you for coming and sharing all of your data with us and all the work. This is really helpful. As you know, we are part-time and it's hard to know everything. And so this is definitely helpful. Can you put the chart back up? Because I just had a question, probably for the one with the go back one. This is one you explained during our counselor day, and I need to wrap my head around it again. And I imagine there's people in the public that didn't understand it as well. But the coastal balance and the month end, just could you explain what those columns are? So I understand why we don't get credited for the, we bill out, we get back what Medicare, the different insurances will pay us. Is the adjustment an actual adjustment, or like what is that adjustment? Is that what we? You're on mute. Yeah.
All right, sorry about that. So the easiest way to explain the adjustments is if we transport a patient and we bill them $700 for all of the therapies and treatments provided along with the transport and mileage. We bill them $700 and that patient has Medicare for their insurance provider. Medicare will look at that bill and say, you know what, for a ALS level call, we only pay $300. That's the fixed federal rate for an ALS level service. So we would bill $700 under the commitment. Under the credit, we would get $300 as to actually what they would pay, and the adjustment would be $400 as to what they would not pay. They made an adjustment that we have no means really to go back and collect.
Right. So just like when we see our insurance bills, and then the coastal balance. So what are these balances? Is that rolling over from some?
Those have rolled over from previous years since they provided the service.
Okay.
So, so the ones you want to look at are the first 4 columns there.
Okay. And then does that revenue go into the general fund?
Yep. So all of the revenue collected from ambulance transports, Medicare, and the invoice for Westhampton for $25,000 all goes towards the general fund.
Okay. And how about you didn't mention any, and I'm just wondering if were there any injuries on the job this year, and what types of injuries did our fire department members sustain from their work?
Yeah, no, and that's a great question. And certainly one of the things I talked about in terms of overtime as a driving factor is injuries. And when we looked at some of our initiatives this past year, particularly with the CARES funding, we looked at different equipment and technology that can help minimize that potential. Right before we took delivery of some of the power loading systems for the ambulances, we did have one individual suffer a shoulder injury. He will end up having to get surgery on that. But in terms of answering your question, that was the one injury on duty, was one shoulder injury. We took delivery of those power loading systems for the ambulances soon after that. And that certainly has helped minimize the potential for those types of situations.
Okay, thank you.
You're welcome.
Taylor, let's see.
Yeah, thanks, Chief Norris. I think it was really good information. I would just say, like, I understood everything, and you know, I've been you're my third fire chief that I've worked with, so I'm glad to have you here. I would just say one thing: it seems like you're good at collecting data, and that's great. And I would ask that when you do work with Williston, I know you mentioned that you guys were doing some fire safety training with Williston. If you know, as you do work with Williston, it's just a request that you would just, you know, make sure that you do a full inventory of the staff and the time that you're sending to Williston. And that may seem like a random, like left field question, but you know, one of our other committees is working on a pilot agreement, and I think it's really important to like show how invested our you know, taxpayer funded services, you know, that are being used basically for free, you know, are being put out there. So I just want to make sure that that's something that you account for as you work with the nonprofits in our community. So that's basically all I had to say. So thank you.
Yeah, no, and that's a great point, Councilor Derby. And I talked about a number of the different funding mechanisms and grants in the updates earlier tonight. And more specifically, one of the ones that we did work with Williston on, they bought the department 2 brand new ammonia meters in the amount of $4,000 that they purchased outright for use throughout the city, and then also some of their facilities as well. So in terms of your point of that public partnership with them, it certainly has worked out well, but we certainly will continue to monitor that for you going forward also.
Appreciate it. Thank you.
You're welcome.
Thank you. Thank you, Salem. Thank you, Chief, for this report. I think this is amazing. I just want to make a few comments. First, I want to welcome the 3 new firefighters that we have in our community. I think that's amazing that we have 3 new members in our fire department, so welcome them. Do you know when probably we're going to have a response from the grants for the ambulance?
I'm hoping, Councilor Gomez, to hear from them within the next month. As you folks know, the federal fiscal year goes from October 1st to September 30th. So they have to have all the money basically spent by September 30th. So they administer these grants over the course of a couple of weeks. They'll disperse a few million at a time. Those that aren't going to score high enough will get turned down letters. So I'm hoping to hear one way or another within the next month.
Okay, thank you. And my last question tonight for you is going to be this information here, because I want the public to be sure our city is safe. Can you explain better what is that? The time without fire protection is 13 hours. We don't have anyone in case something happened with the fire. If my house is on fire, who's going to respond? I think the public should know how the fire department is going to address this issue. And if that 13 or 17 hours, is that normal in each city or town? Is an average that is normal, or we are spending so many minutes without protection?
Yep. So again, first defining what does that mean? Time without fire protection. That's basically you have less than 2 firefighters in the station. So you have either 1 person left or 0 people back. And again, even when I talked about the 2 people, that basically is someone to drive the engine and someone to pull a line. In terms of what does that 13 hours mean as an average, that is over the course of a month, not consecutively, but sporadically over that time frame. There have been those periods where one firefighter or zero firefighters are available to respond. So to answer your question, how do we overcome that and what mechanisms are in place? We have mutual aid agreements. I kind of alluded to it earlier for both fire and EMS. So in the event we don't have, for the sake of this conversation, there's no firefighters available in the city and any call comes in, we have mutual aid agreements with all the surrounding communities and they would have to respond as available. If they're not tied up in their own community with their emergencies. So you would get a response, but you would certainly see a delay in that response time, particularly depending on where that community would, where that resource will be coming from.
Thank you.
You're welcome.
Thank you, Chief, for your time, and this report I think is amazing. And I will ask again to the clerk of the committee if she can add this to the agenda, to the minutes, so that the public can have access to this data and information.
Did you send it to me?
I will send it to you as soon as the minute's over.
And then I'll put it in the minutes. Okay.
Yeah. Thank you. Thank you, Lindsay. Thank you, Chief, again. Thank you. I appreciate it.
Thank you.
Yep. So let's move on to the continuing of the Mayor's Pledge remaining policing report. So I'm going to share, if I can find it. No. Just 1 second. There you go. Can you see this? Yes? Okay. So we got this today from the State Rep Dan Carey. This is part of, this is the summary from the police reform they passed probably a few months ago at Beacon Hill. And there's a law now. So I will share with you guys what he sent us to us. And I'll send that to the two committee members, and I just sharing this for the public. So we have here what they passed: Massachusetts Peace Officers Standing and Training Commission, an independent commission considering primarily a civilian with responsibility certifying and disciplining all law enforcement officers in the Commonwealth. So that is they're going to create a commission on membership. That will come from the governor, the AG, and from the governor and the AG, those members. So the commission duties will serve as the civilian enforcement agency to certify, restrict, revoke, or suspend certification for officer and agencies, refer cases for criminal prosecution, and report annually to the legislature, governor, and the attorney general. So this is the duties of that commissions. Let me go back. I'm sorry. Let me go back. So that is the duties of the commission. We're going to leave it just a few seconds before I keep moving so the public can see it. We have the Division of Police Certification, Division of the Police Standards, Hearings and Appeals, and we have here all what they're supposed to do. The division should jointly with the MPT establish uniform policies and standards for the certification and all law enforcement officers. And I mean, I'm not going to read it all because I think it's 11 pages, 9 pages. So it's gonna be a lot of information, especially after we saw the report from the fire chief. I just want to present it to you and to the public that people can see it. Yes, Lindsay?
I will attach it to the minutes, but I'm wondering if you could send it over to Lindsay at the mayor's office, and she could attach it with the where they have the mayor's pledge report. So it's just up quicker, because this won't be attached till we approve it next month. So
Yep, I can do that. Yeah, that would be good.
So,
thank you.
Okay. Yeah.
Sure. And again, I'm just sharing now because I wanted the public to see it. You can see what the new reform include and definitions with the physical force and what the police officers have to do, deadly force, ban of chokehold, the charge of firearm into a fleeing motor vehicle. We have the tear gas and what they're supposed to do now with the new reform, duty to intervene, and we have everything what the police officers should be doing if they see something that one of the other officers are doing, and what they have to do, and the procedure that they have to follow. A report, and the supervisor have to do the report too, and have to be clear what they have to do in mass demonstration and protest. So basically, this is the summary of that bill. By the way, it passed because I sent it today and was expecting to the state rep and the senator to be here tonight, but they didn't show up because they're busy doing what they're supposed to do. I just want to share with you and the public, and my idea is, I'm going to stop sharing this because I want to talk to the committee, is that I review this. I review my notes from the public comments and the report per se from the Mayor's Pledge group. This is my idea. I just want to create a report from me, and I want you both to do kind of the same for the next meeting, and that way we can start sharing our thought and what we're thinking about it, and how we can include or make better the Mayor's Pledge report with the reform, because I'm pretty sure after read the reform from the state level and the recommendation from the Mayor's Pledge group, that new bill covered a lot of them. So I think we should spend time reviewing from the law and that reform how we can integrate stuff and how we can eliminate stuff because they already have to do it by law, and bring it to the next meeting with the report. Councilor Derby?
So Omar, yeah, that's great. and thanks for sharing that. So I just want to make sure I'm on the same page as you. So you said create a report. And so that's just basically ideas of what we think of the new law compared to the Mayor's Pledge report, which basically our only capacity is to either, recommend or as a whole or not recommend as a whole, because we have no authority to implement any of these changes. I just want to make sure that's
you're correct. You're correct. We don't have any power to tell the mayor that she have to do this, or hey, because we're going to be a new election, we don't know who's going to be the next mayor. But I agree with you. We don't have the power. It's just going to be recommendation from both, from the police reform and the report that came from the Mayor's Pledge group, and the mayors can do it or they cannot do it. So, but it's going to be a recommendation for our committee to the mayor.
Thank you for the clarification.
Yep. Lindsay, I see. I think you're going to say something.
I guess I'm just wrapping my head around it because we got a pretty thorough, and I don't know. I guess it's kind of a frustration of maybe being in the city councilor position versus just really wanting to sit down and do tangible work in collaboration with the police, with community members. So I'm just kind of wrapping my head around this charge because we have this report that was already written.
Mhm.
So I guess like taking it like kind of, I guess what I'm thinking is like looking through it, everything we've heard from residents, from city officials, and just kind of coming out with some next steps that we're recommending to the mayor. Is that what you're saying?
Yes. And what I want to try to send from this committee is something. It's going to be a recommendation, but a tangible recommendation to the mayor, something that the mayor can implement it in our community. Again, I think the data is really important for the community to have it. But if you see the reform that came from the state, they're already mandate now to do it. So again, I want to take these few weeks to go deep to that report, and I'm talking about the report from the state and the new reform, and how we can integrate that with the report that we get from the Mayor's Press Group, and send a tangible recommendation to the mayor to make our community more safe, and work with the police department to implement this new probably technology with the data, and being more accountable, be more transparent with the community.
Right. I guess there's also things that I'm wondering, like places for our committee or other committees in the city, the CRC. I was just thinking while Chief Norris was sharing the work of the fire department and how it'd be nice to set up regular meetings like that with the police department as well. I guess they're thinking about meeting quarterly. I would love for us to maybe have some community research questions or certain data that we're interested in, and we could have quarterly opportunities for conversation right here in this committee. So I guess that's some of the things I'm thinking about. Some of it maybe, not mandated things, but things where we're inviting and asking that this happen in a spirit of improving community relations, improving transparency, and building relationships within the city. It certainly feels good when I get to sit down with, when I get to ride around with Sergeant Greavy and talk to him and learn a little bit about the role of the Easthampton police officers. It's helpful when we went to do the East City Council Academy, or I don't forget what he called it, in the fire department, but and also, addressing concerns, of course, in the city in a way, and just sitting down and having those hard conversations. And I think with the end goal of everyone feeling safe and building those relationships. So I would hope that open communication could also still keep going forward through our committee as well.
100% with you. I do agree, especially after today with the report from the Chief Norris. I think we should create something with the Chief Alberti, and I'm pretty sure he's going to be on board with us and give us a quarterly report from the police department too. And I think the community need it. I think the community need to know what is happening with the police department, not just with the police department. I mean, this is a public safety committee, and that's what we're talking about, the police department and the fire department. But other departments should come to the city council and give us kind of report, because people should know what is happening in our city. And I hope when we start doing it, the Chief Alberti send Officer Greavy and other officers to the committee, and that way we can know them too. I think it's amazing that the community should know who is our officers, and I think this is a good opportunity for them to start creating that relationship.
Yep. Had another thought, but it flew away.
I'm sorry, I talk too much, I guess.
No, you don't. My thoughts are fleeting. I was also thinking it'll be nice when it's not on Zoom as well. And I am getting a little Zoom fatigue, and I think being in the room with other humans will feel good.
Yes, and I hope our next meeting will be a 50 patient, and them there with, again, I'm expecting all three came with with some ideas and how we can send a recommendation to the mayor. And there we can address something and create a really good document to send to the mayor and to the full city council with the recommendations. Being saying that, I don't have anything else in the agenda. We can schedule the next meeting. If we got, before the pandemic, again, we always met the first Tuesday of the month. I don't know if the two councilors want to keep doing the same, want to change the day, or I'm okay with the first Tuesday of the month.
I'm going to be gone.
You're going to be gone that day?
August 3rd.
Yeah.
Where are you going? Just kidding.
Out of the country.
For how long you going to be out?
Until the following week.
Oh, what about the 17th? It will be okay with you?
Let me see. Well, I have something on here, but I don't know what it is.
I want to try to keep it Tuesdays. That's why.
Yeah, either the 10th or the 17th would work for me.
Okay, the 10th is good for me. Lindsay, are you okay with the 10th?
Yes.
Okay, let's schedule August 10th and I hope it's going to be at 50 pacing. You want to keep at 7 p.m. or you want to do a little earlier because it's going to be 50 pacing? I'm okay at 7 p.m., but
I'm fine with 7 too.
I'm fine with 7. Yeah,
okay.
Slightly later. I also want to make a comment to the public here that's here. So there's members of the public here that have been following this closely, have read the report. And so please feel free to email me. I'm sure the other counselors would also welcome your emails. If you have tangible ideas that we can put into motion in our city to address a lot of the concerns we've heard in terms of bettering relationships, increased transparency, and so please email me.
Yes, and if
Councilor Gomez assigned me a report, so
yes, and if anyone from the public wanna they couldn't find a copy of the summary of the new reform, please email us, and we will send it to you by email or any document. We can make copies, whatever you need. We're gonna do it for you. So feel free to ask for it. We have it, and we can share with you.
Yes.
We're good.
Yeah. Or if you want to meet for coffee, I'll do that too. Anyone?
Same. I will take a motion to adjourn.
So I'll make a motion to adjourn. Oh. Second.
We have a motion and a second to adjourn. Any further discussion? No?
No.
So, Councilor Derby?
Yes.
Councilor Rothschild?
Yes.
And I say yes. Thank you, everybody. Thank you, Officer Gravy, for being here. Everybody from the public.
Thank you, Councilor.
Thank you. Thank you, Rebecca.
Okay.